Happy New Year. I want to thank you for all of your continued support as we face down this pandemic that we are in the middle of. And when I say in the middle, I think this is probably going to be the apex as we get through the month of January. So today I want to talk to you about vaccines, all things vaccines. As I've mentioned to you before, the hospitals have been allowed and permitted, rather, is probably a better way to say it, to vaccinate all of their employees first in what we call a Pod 1A, and then we'll move next to Pod 1B. Pod 1B are all other essential healthcare workers. So this would be our physician office staffs in the outpatient centers. This would be those healthcare workers on the front line, like the Department of Health and other places where they're administering care. And then the Department of Health will come out with other guidance to us about what the cadence will be of people to be vaccinated. It's our anticipation that after the essential healthcare workers are vaccinated, teachers, frontline staff, folks who work in grocery stores, those types of things will come, and then those individuals with comorbid conditions, those people over 75 and 65, and then the general public. Governor Murphy has been clear about his desire to vaccinate 70% of the population of New Jersey by the end of April. That is a big, audacious goal, as I said last week, and we obviously want to be a part of that. And the more people that we can vaccinate, the better. And quite frankly, we've been having a lot of dialogue internally about the vaccine, its safety, the first dose, the second dose, what happens. And I think it is a symbolic of what we're going to find in the community and the need to make sure that we answer questions directly. As part of our commitment to our ongoing dialogue, we are hosting a town hall virtually on Thursday, January 14th at 2 p.m. This will allow us to ensure that you have access to our experts to be able to answer your questions up front. One of the things that we've asked is for our staff to talk about the why they got vaccinated. And it's been a wonderful way for staff to communicate with each other, and we decided to communicate with you about the importance for them, and maybe even begin for you to think about why you would take the vaccine. Katie Perez is from our Quality and Safety Department, and she attributed her decision to her infection control prevention colleague, Meredith Spina, who said, "I trust the science. I trust the professionals, and I trust that by collectively getting the vaccine, we protect not only ourselves, but all those who we care about, and together we will make COVID history." Max Calles from our Mullica Hill Security Department: "I'm dedicated to helping others and protecting my family at all times." Philip Hoffman, an EMT, said, "I got the shot for my stepson who has a heart condition." Boots Harris, he's a transporter. He's been with us for over 40 years. He works out of Vineland. He also got his shot, and he said, "I got the shot so I can be here for others." Katie Sittler, an RN, is also from Vineland, said very clearly, "I want to protect you." Those individuals who are closest to the virus, they see it every single day on the front lines. They know the damage of this virus to not only old people and people with comorbid conditions, but to the young as well. They signed up first. That should tell you all you need to know about the importance of stopping this pandemic and stopping this virus in its tracks. And as I've said before, the fastest way for us to do that is to get vaccinated. So we will participate in Pod 1B with the state and offer services to essential workers. Again, just so to remind you, the state will have its own registration process. You should watch for the public service announcements about that, and that's how people will register for this next wave for the essential healthcare workers, and that will continue as we move out to the general public. So if I can ask a favor this week, I'd ask you to say a prayer. Say a prayer that we get through these next few weeks strong and together, and just wishes for a very strong February, because I'm hoping that that's when the virus will begin to be contained and we'll be able to start to see what a new normal looks like. Until then, be well and stay safe.